Today I found a question that I'm kind of unwilling to answer. So someone was asking the doctor, what are the first signs and symptoms of an HIV infection? Much as it's a good thing to be equipped with all this medical information, I feel like there's such a thing as detrimental or unnecessary information. Basically, information that will do you more harm than good. Now, in the case of HIV, the signs and symptoms of HIV that come first are not exclusive to this illness alone. You can find them in hundreds of other diseases, some that are even actually very simple illnesses. So if I were to tell you these things and you were to get them even from a simple disease like flu, you're going to end up with anxiety and depression, and this is not going to be good for you. In fact, this particular phenomenon is very common in the medical sector when you find doctors and clinicians readily applying the symptoms they've learned onto themselves, and then you end up with unnecessary worry and a lot of anxiety and depression. We call it self-diagnosis bias. In my practice, I don't know how many times I've diagnosed myself with cancer just because I have some simple chest pain or night sweats or something simple like that. So when it comes to HIV, my recommendation is that you do regular testing at least every 3 to 6 months, and then you avoid the obvious routes of getting HIV. You'll be alright. But knowing the first symptoms is not going to do you any good.